Hello everyone, my name is Ruby Aguayo and the topic that I decided to pick for my infomercial is cocaine. So a little bit of history on cocaine. It is a stimulant that has been used for centuries. Cocaine itself comes from coca leaves and it was first used in South America by Indians 3,000 years before the birth of Christ. Incas in the Andes chewed coca leaves to get their hearts racing and speed their breathing to counteract the living in the thin air in the mountains. Cocaine was first extracted from the leaves by a German chemist named Albert Niemann in 1859. And in 1880s, that's when it started to become popularized in the medical community. For example, Sigmund Freud used the drug himself and promoted it to cure depression and sexuality. In 1884, he published an article which promoted the benefits of cocaine and calling it a magical substance. Furthermore, in 1886, the drug itself became a key ingredient for the new soft drink Coca Cola. And then in the 1980s, the popularity just increased even more for this drug. Some names that the drug is known for is snow, coke, crack, rock, or powder. Colombian cartels were among the first to sell the drug illegally within the US. Pablo Escobar, known as the King of Cocaine, was the main drug dealer in Colombia and was in charge of the Medellin cartel. Due to high demand, it has been difficult to reduce the production and addiction of this drug, and there have been several drug wars among cartels and cartels against the US. And here on the side, you can see a mugshot of Pablo Escobar, which is smiling because he knows during that arrest that he was not going to get in trouble for drug trafficking in 1976. Some ways that cocaine can be administered is orally, which is known to be the least potent because it is eliminated rapidly in the gut. Another way can be administered is snorting it, and usually a powder is broken up and lined up to snort, and is known to be to best, for example, heat up a plate and then line them up on there to snort. Another way it can be administered is through IV, which would be the quickest way to consume large amounts of it. And lastly, it can be smoked in a water pipe. Effects that cocaine has on the body, for example, on the brain, it blocks the reuptake and inactivation of your neurotransmitters. In your cardiovascular system, there's an increase in your sympathetic nervous system, which means your heart rate is increased and there's an increase in breathing. Tissues can be damaged and numbness and tingling sensation can occur as well, such as feeling numbness and shifting of your teeth. Risk and consequences, short-term effects could be decreased appetite, mood swings such as anger or happiness, paranoid feeling, and some of the long-term effects include severe heart conditions, headaches, convulsions, and seizures. During withdrawal, it depends on the amount and duration cocaine was consumed by the person, and there are three phases, which are crash, which lasts 1 to 2 days, withdrawal, which can last 1 to 10 weeks, and then finally elimination of the drug. Some treatment will include counseling, rehab, and most importantly, for the patient to be motivated and willing to make the change in discarding the use of this drug. And that concludes my presentation. I hope you guys enjoyed it. Thank you.